Hello and welcome to Share. Anxiety is a very common emotion. Anxiety disorders, on the other hand, are serious mental illnesses that can be quite crippling. What are the various forms of anxiety disorders and what tools can we use to deal with feelings of worry and fear? That's what we're discussing today here on Share. With us to talk about anxiety and its effects are Mara Zanella, a counseling psychologist, and we also have Meryl Da Costa, the SADC ambassador. Thank you so much for joining us, ladies.
Thanks for having me.
Meryl, I wanted to start with you because you were saying that just recently you had somebody phone you and she was very anxious about her matric results. Was it her matric results?
Yes, it was.
And just going to get them. So I think at this time of year, that is still what a lot of young people are dealing with.
Exactly. We are still getting quite a few calls from matrics in particular, and even some parents as well, feeling very anxious about the matric results. Even though they have already received the results, they're still feeling anxious because they have failed, or they may have passed, but they didn't pass as well as what they wanted to. So they're feeling very anxious, very helpless, worthless, and they're going through a lot of emotions right now.
So what did you say to her when she phoned you?
Well, first of all, don't panic. I think failing matric is not how it used to be. It's not the end of the world. Yes, it is crucial, but there are other options to you if you have failed, like rewriting or getting your exam papers remarked, or taking supplementary exams, or even redoing matric, or even taking a gap year to think about what you really want in your life and just regroup and figure out what you want. So first of all, don't panic. Make sure that you speak to your teachers and your headmaster of what your options are. And if you're really unsure, call SADC, speak to a counsellor. We do have so much information and resources for you to figure out and to help you decide what you want to do.
I want to come to you, Mara. What other anxieties do you think young people in particular are going through at this time of year?
Well, I think obviously the result is a big one. Things about going back to school, worrying about what class they're going to be in, what teachers they're going to have, are they going to succeed, what exams they're going to have to do, all of those types of things. There are lots of anxieties. Children worry about a lot of things that, as adults we worry about as well, but they have those worries, extra worries too.
And they probably take it so, there's so much pressure, that something that as an adult you might have, the experience and the coping mechanisms to deal with them. For them, it might be a bit bigger.
And I think they're getting so much pressure from society in general, and from their parents. Even those A students have got so much pressure coming from their families, but there's also so much pressure coming from within. I think a lot of the students are putting so much pressure on themselves to achieve and do well. Either that no one has matriculated in their family before and they were the ones that were going to change and break the cycle. So they're putting a lot of pressure on themselves, and they don't need to do that. I think we just need to sit, just calm down, just sit back and just reflect, and just know that having your matric, failing matric is not the be all end all. Again, there are different options you can take.
And as Meryl says, often when it comes to anxiety, what we do is we just have a lot of these racing thoughts and we catastrophize. So worst case scenario, I've failed, it's the end of the world, I'm never going to achieve anything. And when we work with anxiety, a lot of what we do is we say, well, break that down. Make it more practical. What are the options? Look at the various options. Try and understand something from another person's perspective. Speak to people about it. Because there always are more things out there than we can think about on our own. And when we just let those thoughts race around, we're not going to be able to practically think about the options.
I also I wonder, because I'm thinking that why does it get to this? And I think we discussed this, when we were getting the results in December already on the show, we were talking about this. But I would like to speak to it a little bit again. Is why do we wait for now? Why do schools wait? Why do young people wait? Why do parents wait to start talking about your options now, when we should have been talking about these options probably throughout your school career, or at least throughout your high school career?
Absolutely. Yeah. It's a good point. I mean, certainly, when it comes to choosing your subjects, even in, sort of grade 9, that's when things need to be spoken about, even if they haven't been spoken about before. Because, what subject are you choosing? What do you want to go off and do? Do you want to go to university? Do you want to go to a college? Having all of those options available to you, they should be spoken about much, much earlier.
And again, I would like just to talk about when we're talking about careers, is that here you are, you're choosing your subject. And we were speaking about this in the makeup room, is a lot of young people are choosing careers that they don't even know what they're signing up for when they go to university.
I totally agree. I just think there's so much pressure coming from parents, be the doctor, be the lawyer. They don't even know themselves. And I think we forget that these matrics are still kids. I don't think they know themselves what they want to do. I think a lot of people, that's why they have these midlife breakdowns, because they realized the last 20 years they've been doing this job that they absolutely hate. They were kind of forced into doing this or going into this field, and they hate it. I think
that in itself will cause anxiety.
Absolutely. So I think taking the time out and realizing what are your options, what do you really want to do, and perhaps during this time, if you have failed, if you haven't done as well as you want to, perhaps considering a gap year or speaking to a professional, speak to a counsellor at the university that you're thinking about, or a professional private counsellor, and discuss with them your options, your personality traits, what you look for in the future, and they can help you decide what's best for you.
I want to talk a little bit. When we started, we were talking about anxiety, that it's something, it's an emotion that if you're alive and you've got a pulse, you've been anxious at some point in your life, right? So that's pretty common. But then there is this side of an anxiety disorder. What is the difference?
It's an important distinction, because you're absolutely right. We all have anxiety throughout our lives. It's a very normal reaction. When it comes to an anxiety disorder, the difference is that the anxiety is persistent, and it starts to negatively impact on our functioning. So we have anxiety every day, or we start to avoid places or people or things like that because we're too anxious to go into that environment. So that's the big distinction. Some anxiety can be quite motivating. So it gets us to prepare for things, it gets us to set an alarm to get up on time. So it's quite a useful emotion. But an anxiety disorder takes it to the extreme, and it means that we stop functioning at our optimal capacity.
So how would a person know, say now, let's take a matriculant as an example, because we started talking about that. How would they distinguish between, this is just anxiety because I'm worried about what my future holds, I'm worried about my results, I'm worried about what this means for the rest of my life too. I might have, or if it's a parent that's watching their child, they might actually have a problem that's bigger than the anxiety of what we've discussed so far.
But I think normal anxiety, like we were discussing earlier, is natural and normal and can actually be quite helpful sometimes. But that's just sort of the little butterflies in your tummy, and you may sort of get a little bit of a sweat. But then that anxiety disappears very quickly. If it is persistent, it goes on and on and on. Nothing you can do will change it, and you start to avoid situations and circumstances. So I think, for instance, with a matric in particular, they may avoid doing anything at all, whether it's inquiring or what they could do. Could they get their papers remarked? Could they take an exam? They will avoid that absolutely. So I think that might be a first sign that is a problem. They may not be speaking to anyone. They may totally isolate themselves, stay in their room, which is, we know, typical teenage behavior, but it might be very excessive.
And again, this is now a third element that you're bringing in, is how do you then tell the difference, of this has gone on too long. Would it have been triggered by the anxiety that is school related, and then it becomes a problem, or would a person have a predisposition to it?
It could be either. So we do see some people who have a predisposition. They might have grown up in quite an anxious family. They might have a sort of, their sensory system is a bit more susceptible to those cues from our body, because what we have to remember is that anxiety is hugely physiological. So it comes with a lot of cues in our body. We have our racing heart, we shake, we get flushed, we get hot and sweaty. So all of those things are going on. And if we are, if we're hypervigilant to those cues, we're going to suffer from more anxiety, because some of those things are normal. To have a bit of a sort of funny feeling in your stomach, maybe you're hungry. Somebody who feels anxious, they're going to think that's an anxiety, something's wrong.
So I want to ask you, what would be overreacting in the sense of this is what a child is going through? If I'm a parent, this is what a child's going through. It's absolutely normal to, I really do need to get my child help now.
Well, as Meryl said, when the anxiety distinguishes on its own, then that's quite normal. When we start to see things persisting for, if it comes to a generalized anxiety disorder, we look at about 6 months. So this person is anxious, they're having these anxious thoughts, these anxious feelings, these reactions in their body for at least 6 months, most of the day, every day. So that would be something that's quite telling. As a parent, even if it's normal sort of teenage behavior to stay in your room all day, you still know your teenager. So you're going to be able to distinguish between what is my normal teenager's behavior and what is actually slightly abnormal for my teenager.
And what are the first things that a parent should do if they do see that it is something that's persistent over 6 months, like Mara said?
I think start very small and simple and speak to someone at SADAG. So speak to a counsellor and give them the information and explain to them what you are seeing. And they will then be able to refer to you whether you would need to take your child to see a psychologist or if it may just be normal sort of teenage behavior. But I do think do a bit of research, definitely speak to someone at SADAG. If you want to skip that step, then go straight to your GP that you have obviously a very good relationship with, or find a psychologist in your area. But I do definitely think that a parent should take the initiative and just find out a little bit more information.
But when we come back, I think one of the things I would like us to talk about is those triggers, because I think a lot of the time it's not just that you're going to be anxious out of the blue, but then you can tell us more about that when we come back. Well, with a good understanding of what anxiety is and how it can affect us, it's important to also empower ourselves with tools that will help us handle the anxious times a little better. We'll be talking about that next.